Okay, are we live? I think we are. Today, ladies and gentlemen, we're going to talk about ears. What?
Very good.
Ears. We're talking about ears today. Common problems, issues, things that we see, all those things. So, I'm hoping that... Oh, hello, Stephanie Lowe, and probably all the other girls. I miss having some camera folks here today, but we're talking about ears today, folks. So, let me see if I can turn this camera around. Hey, Chastity Marie. There we go. Boom! Okay, no camera girl here today, so I'm trying to get this thing rolling on my desk. Okay. What's going on, Facebook world? It is Mr. Chris, and we are talking about the ear today. So, this is an awesome time for this topic because I've had, probably 5 ear complaints just this morning. So, we're going to talk about all the issues that go on with ears. I hope we're going to talk about all of them because some of them we may or may not get to, but we're going to talk about the big ones. So, let's go over a basic anatomy of the ear. Camera girls forgot Facebook Live. How about that? So let's talk about the ear. Now, this is a cool little deal here, isn't it? A little thing. It's missing the tympanic membrane, so we'll talk about that. So this is the ear. This is called the pinna, the auricle of the ear. We've got the ear canal here. This is the external auditory canal. Okay, and then right in this area, you're supposed to have a little eardrum. Okay, most people call it eardrum. Hey, Jamie Bird, what's going on? So the eardrum's right here, and then on the inside of the ear, let's see if I can do it this way. There you go. Oh, that's a good shot. Inside of the ear, you got the ear bones here, inside of the ear. Now, oops, let me take this part out. This part draining down the ear is called the eustachian tube. Okay, so what are some problems that can occur with this? I'm gonna see if I can do it this way. Let me see here. Hey, Jordan Long. Okay, so this is probably gonna be a little bit better. So you see the ear, auricle, all this stuff going into the external auditory canal, and then you have eardrum, you've got the bones, then you got the eustachian tube that comes down. Interestingly, this area right here where it kind of gets smaller, oh, I hope you can see that, called the isthmus, okay? And that's where a lot of issues and problems can occur, like this, okay? Isthmus of the eustachian tube, that's where it gets blocked, all right? Hey, Emery. So you've got all this fluid in the middle ear, okay, and it can't get down, okay, it can't come down. This is going to create a problem because bacteria, boom, look at this little thing, man, this thing is awesome. Middle ear infections is what we're going over first. Bacteria will be in this fluid right here, okay, and it can't get down the eustachian tube, okay? Now, why would this be swollen? This would be swollen because of like a viral infection or basically upper respiratory infection in kids. Going down the nasopharynx would be like right in this area, okay? So, again, eustachian tube draining down. It's not draining because it's blocked off. You get bacteria in there, and then you end up with an otitis media, okay, or a middle ear infection. And this is what it looks like when you're looking into, what's up, Ames? When you're looking at an eardrum, you see how this is like super red, okay, it's bulging, the landmarks are obscured, can't really see anything going on back there. So this would be like a proper otitis media, okay, a proper middle ear infection is what we got going down right there. Now, that being said, that's all happening on the inside of the ear, okay? And then frequently, so what does this kid look like when they come in? Most of the time, this kid coming in, their mom will say, hey, Mr. Chris, you know, I've had this, my baby's been sick, he's been fussy, he's had a lot of snot going on. Remember, this is all connected. So they would say, he's got a lot of snot, he's been fussy. Every time I lay him down, he cries. And the reason for that is because all the pressure going into the ears. And so as a part of that, we would treat that, right? We would treat it with antibiotics. And the whole goal is to get rid of the bacteria behind the eardrum there, okay? So that's otherwise known as a middle ear infection. We see them all the time. We have kids that need to come back for a recheck, and the reason for that is because sometimes the antibiotics cover, like if there's a spectrum of germs or bugs that cause ear infections, certain antibiotics will cover just this much, okay? Other antibiotics would cover this plus this, but they're a little more, I guess, hard on the gut, so we have to change it sometimes. So that's a middle ear infection. Okay, again, we see these all the time. They're very common, especially in winter when kids have upper respiratory illnesses, things like that. Now, let's talk about another type of ear infection called swimmer's ear. Have y'all ever heard of swimmer's ear? I hope so, because it's summer. So let me flip this thing over. Now, we're back at our ear. Okay, or I guess we could use this one too. Ooh, Blair Witch Project. Okay. So you got the ear, okay, and when kids go swimming, this is inflammation. Let's put the inflammation in there. Boom. Look at that. So kids are swimming, lake water, pool water, whatever you have, it goes into the ear right here. And what it does is it changes the pH of this canal. Okay, so why is that important? Your ear canal is supposed to have a certain pH. And so when it becomes less acidic, it gives opportunity for bacteria to grow and grow and grow, and then they end up with this really, really sore ear, okay? And so we have to treat that with drops. Now, the reason why we can treat swimmer's ear with drops or an otitis externa with drops is because it doesn't go past the tympanic membrane or the eardrum, okay? That's what the eardrum looks like when you look in. Drops will come in here, they'll kill the bacteria and restore the pH. Okay, so that's a swimmer's ear. Now, that being said, if you have an otitis media or a middle ear infection, a lot of parents will say, hey, can I just get drops for that? And the answer is no, right? And the reason why is because if we give drops to come in here, it will not pass this barrier, otherwise known as the tympanic membrane or the eardrum. It won't go past there, so it won't treat the bacteria back in here. Okay, so that's super important. That's the difference between an otitis externa and an otitis media. Now, all of that being said, we can have some complications, all right? We can have some complications. So some complications with this would be if you have all of this, you can see all this would be pus back behind the eardrum, and it's bulging out. You can see it, all right? It looks like this when you look in. You can actually have it where it ruptures, okay? So when it ruptures, all of this, the bacteria, all of this starts to come out of the bottom of the membrane there, okay? And this little thing actually has a diagram. Would you look at that, people? It has a diagram. So pus, you've got the eardrum, and then there's the rupture right there. So you have all of this coming out of the bottom, okay? So what does this mean for parents? That or for anyone really? That means if you have an earache, all right, if you look like this little girl, bless her darn heart, okay? If you look like her and then you have drainage coming out of the ear, big problems, okay? That means you need to come in and get seen, all right? There we go, all right. So that's just a little bit about ear infections, okay? Again, we see them all the time. I'm gonna put my ear in front since we're talking about ears. So I know what you're thinking. You're thinking to yourself, well, Mr. Chris, I don't know. I just know my kid says their ears hurt. And how can you really know if it's an otitis media and otitis externa? How do you know if it's ruptured? Well, come on in. Look who's a guest star today, folks.
Hi,
Dr.
kids.
Wagner.
Hi.
Okay.
What are we talking about?
We're talking about ears, Dr.
What?
Wagner. Huh?
What?
Ears.
Oh, ears.
Ears. So let's do a recap for Dr. Wagner. We talked about a middle ear infection. Oh, let's do it on this. Maybe not. Okay, we talked about middle ear infection. We talked about an otitis externa or swimmer's ear. We talked about if it ruptures, what happens. Okay, so now we're getting to what kind of cool tools do we have in the office to help with ears?
Oh, okay. So let's wash out the ears. You want to?
Oh, why would we need to wash them out? Oh, Chassie said, hey, Doc.
Hi, Chas.
Jordan said the best providers.
Yay. So you could have something in your ear that would make it hard to hear. The most common thing is earwax.
Earwax.
Earwax. So what else? We could have an eraser,
A bug.
a bug.
Construction paper.
Well, yeah.
So let's say, okay, Dr. Wagner, so you're looking in an ear and you see a bunch of earwax right here. What would you do?
Well, I would not put a Q-tip in the ear.
Oh, everybody hear that? Hey, Liz, what's going on? Don't put a Q-tip in the ear, says the doctor.
Because
So you
all
know
you
it's
do
serious.
is cram the wax further down. Like
Cramming it.
if you're trying to tamp a cannon and we don't want cannonballs of wax.
No.
So, I have this cool little loop for professionals only.
You want to grab one?
Well, I will.
She's going to grab one.
Okay, I'll show you.
She's going to go grab one. So this is another issue that we have when kids come in. They will have something that we call a cerumen impaction. Hey, Emery! And Mason's in love with Dr. Wagner. Good job, Mason. So, cerumen impaction, or when the earwax gets all clogged up in there, Dr. Wagner is going to show us one of the cool things that she uses to get earwax out. I have the same thing, it's just a little bit different, but we'll wait till she gets back and we'll show you exactly what we use. I bet she's coming.
I am coming.
There she is. Here we go. Hey, Mason is looking at you with
Where's Mason?
with his love eyes.
Oh, awesome. Hi, Mason. Okay, so remember, we talked about earwax in the ear, and this is a little bitty loop. You see it? It's just like a little cowboy lasso.
That's compared to a pin.
So we go in the ear and we pull some wax out, but if you go in the wrong way, you can scratch it, make it
Scratch it.
bleed, okay? Or if you go too far, you're going to rupture that tympanic membrane Chris talked about. So we do this, you don't. My mom used to use a bobby pin, don't do it. And we take the wax out. But if we can't get it out, what do we do then, Chris?
We've got a special tool, don't we, Doc?
We do.
What is it?
It's a cool little
Sprayer.
water gun. Put it right in here and spray.
Whee! So that shoots out water. All right, for all the kids at home, I want you to see this, okay? If you ever have to use this thing right here, two things. It's not a needle, okay?
It's real soft, look.
And it's soft. Look at that. It bends. So when we put it in your ear,
Doesn't hurt.
it's not going to hurt you. It's not going to hurt you at all. All right, and we make sure the water's nice and warm, right? So that's something that we can do for an earwax removal. Now, I do have a question, Dr. Wagner. Here was the next point of discussion.
Okay.
The point of discussion. I'm gonna turn this around. Kayla, what's going on? Okay, so remember we talked about when this poor girl, bless her heart, when she has an upper respiratory infection, we talked about how sometimes you can have some inflammation in and around the nose, and some, I guess, secretions will kind of come up this way, and they'll get back here. So now, Dr. Wagner, I have a question. How would you know if behind the eardrum, if it's what we call an effusion, or if it's just, I'm going to drop you guys. Here we go. Okay, how would you know if it's just an effusion or if it's an actual infection? Is there anything that we can judge the eardrum with?
Well, there is. First of all, it looks different.
It does.
Sometimes it's hard to see. The little bones that Chris talked about, you can see them with water, you can't see them with pus. So most of the time we can see, but if we can't see, we have this really cool tool.
Whoa!
This is called a tympanogram. And it's a little poof of air, and it vibrates the eardrum. And if it's pus, it can't because the pus is thick. If it's fluid, it can't as much as air. Air vibrates good, fluid a little bit, pus not at all. So we measure that, and we can tell. Pretty cool, right?
Yeah.
Yeah.
So that way, there's no guessing. We
No
have a way.
guessing.
We have a way to tell for
Even
sure.
though we are trained professionals, we are trained professionals.
We are trained. We are trained.
Trained professionals.
We're trained. We are not trained at technology, is what they call that. So, with Facebook Live, sometimes who knows what's going to happen. Now, so Doc, let's just say that my kids, and I've got 3 girls, as you all know. Let's say my girls keep getting ear infections. What's kind of the cutoff, or what do we do about that when they just keep getting them over and over and over?
Well, usually the main reason is Chris talked about the fluid not draining from the ear into the nose. So that could be if there were allergies or a bunch of colds that make the nose stuffy. So we would fix that first.
Mm-hmm.
If that doesn't work, sometimes if we can't get it to drain the way God intended through the nose, we have to put a tube in the ear that makes it drain out the other way.
Mm-hmm.
Because that fluid acts like a stagnant pond and the bacteria love to grow in it.
Yes.
And that's the reason for tubes. The problem with tubes is it's a hole in the eardrum and it scars.
Mm-hmm.
Okay, so the eardrum doesn't vibrate as well if that scar is too big. So we don't want to do it unless we have to. So we usually say 3 ear infections in 6 months, 5 in a year. It's kind of, or if we get one bad infection that we can't clear up with 3 rounds of antibiotics, those are all kind of reasons to say, yep, we better try something different.
It's very true. So with my little thing here, I do have a picture of what that would look like. Let me see if I can do this here. So as you can tell, we talked about this would be the infection. Dr. Wagner was talking about the bacteria in the stagnant pond. So down here, we talked about some antibiotics and treatment with those. Down here is called surgical management. So what they do is they go in and they would just cut just a very small hole in the tympanic membrane or in the eardrum. And then they put, this is a side view, so they put a little tube in there, and that's kind of, I guess that kind of looks like it. But
it looks like a thread, a spool of thread.
Yeah, and
so
they put it in.
it's wider on either end, which makes it stay in place.
And it'll stay in, yeah. Jordan Long says, we love Mason's tubes. Jordan, I hope that they've helped. Give us a thumbs up if it helped. So,
nice.
But here's what I think everyone here at this office, what we would want you guys to hear, okay? Our goal here at this office is to try and keep kids away from surgery. Would you agree with that, Doc?
I agree with that.
Yeah, so we try and keep kids out of the operating room. We try and keep them as healthy as we can here in the office. However, sometimes it's just unavoidable.
Right.
And so when that time comes, we have some great people that we trust with our kids here at the office. And so we'll refer them out to those guys, and then they do a great job taking care of them. So, all right, so let's recap. So we've talked about a middle ear infection.
I'm leaving. Bye.
Are you leaving?
Yeah.
Oh.
Keep going.
I'm going.
Doing
Here we go.
great.
Thanks,
Bye, guys.
Doc. Bye. Okay, she'll get more likes than me. Okay, thanks, Doc. Okay, so let's recap. We talked about middle ear infection. We talked about an otitis externa or a swimmer's ear. We talked about cerumen impaction, or when you get a buildup of earwax that we need to squirt out, okay? Or we can take it out with this. We talked about tubes. We talked about antibiotics. Let's see. You know, that was kind of all I had in mind. So with that being said, I want to take a second and say, does anybody have any questions about ears that they are just dying to know? Does anyone have any questions? If you have a question, just post it right there in the thing, because last time I think I got called away from my Facebook Live because I had to deal with an emergency. So does anyone have any questions? I'm going to hang on for just a minute if you do. Let's see. What's up, Michael? I hope Tubbers is watching. I hope so. So while if anybody has any questions about ears, I'm going to let you ask those. But behind me, you may be wondering about my new background. This background is the paper that we use on our exam tables. So when kids come in, this is what they see. These little guys right here. Oh, we got Jordan. Here we go. What is a safe way to clean out wax? To clean wax out of your kid's ear canal? Jordan, that is a great question. You know, there's a couple of ways. I think one of the safest ways that you could do that at home, okay? Now, I'm going to probably get a lot of pushback from some of the parents, but one of the safest ways to do that at home is you can, oh, hey wife, hey girls, I'm sure y'all are watching too. You can get an over-the-counter product. It's called Debrox or Debrox, and that you put it in the ear, and what it does is it softens the earwax, and then the earwax just kind of comes out on its own. Oh, Michael, I wish old Tubbers could have been on the show. That would have been awesome. Jordan, it does look gross. I agree with that. When the earwax is just kind of coming out. Now, I would say this, okay? You may get some disagreements on this right here, but as a parent, okay, we all are like Jordan. We want our kids' ears to look great, okay? So let's pretend like this is your kid's ear, all right? They have the size of an old man, like me. Okay, so I think it's okay if you get a Q-tip and kind of clean the outside of the ear, okay? Clean the outside of the ear. That's okay. But don't be taking a Q-tip and like ramming it on, like if you have the Q-tip and it looks like this, you're going, oh, I'm going to clean out your ear. I'm going to clean it out. Here I go. Oh, you're so happy. Wah! Okay. Don't do that because you can rupture that membrane there in the ear. Chastity Hill says, what are some symptoms of an ear infection? Very, very good. I do, wife. I remember that. Some symptoms of an ear infection. Most of the time you're going to have kids that are just more fussy in general. Sometimes they'll be tender to the touch. So when you pull their ears, it kind of, it'll hurt them. You'll visibly be able to see that. In the younger kids, you'll have, they'll do a lot of scratching and pulling at the ears if they can't verbalize, hey mom, my ear's killing me. You'll see a lot of that kind of stuff. In the older ones, most of the time they'll be able to tell you, hey, my ear hurts and things like that. Now, again, a symptom of that can be, I see your comment, Amy. A symptom of that can be you just notice a bunch of yellow or blood-tinged drainage coming out of the ear. If you see any drainage coming out of the ear whatsoever, or if the ear smells bad, please come in and let us take a look at that because again, it can be everything from an otitis externa. It can be a foreign body or a foreign object that the kids leave in the ears. My girls that work here can probably tell you we routinely pull stuff out of the ear. So, yeah, we pull a lot of really fun things out of ears and noses, ironically. So, if you have any questions about that, just give us a shout. Call the office here, and we can kind of talk you through that. Oh, we're talking. Oh, Steph, good point. That's a very good point. In the younger kids, especially around teething age, you have a branch of the facial nerve that kind of comes over this way. Good call, Amy. A branch of the facial nerve that kind of wraps around the ear. So sometimes when you bring your kid in for ear pain or they're pulling or they're tugging at their ear, we'll look in and we'll say, you know what, that ear actually looks really good. And the cause of that is actually teething. Teething can cause ear pain. We like to suggest a little Tylenol or Motrin if they're over 6 months. That can help with that. Another cause can be strep. Sometimes strep, you can have some referred pain from the throat and it kind of goes up to the ear. So that is another cause of that. That would actually not be the ear. So sometimes parents will say, hey, my kid has an ear infection, and it's actually not that. It's actually the throat or something else. So there was a question that was presented to me about moms having the little otoscopes at home. Some of those are really, really great. You can actually look in, you can kind of see what's going on. But in general, I would definitely recommend somebody that's totally looked at thousands of ears to look in your kids' ears and say, good job, Tubbers. I'm glad I hope your arm's healing up, buddy. What was I saying? I forget what I was talking about. Oh, a trained professional, because ultimately, your kid could totally have an ear infection, or they may not have one. So, again, we are always happy to see everybody here. We have walk-in hours from 9 to 11, I think. I can't remember, but yeah. So that's all about ears.
Wait, Chris, I have a question.
Oh, we've got Dr. Wagner coming in again.
Okay, Chris, so...
Yes, here we go.
Why is it important that a child come here and not the emergency room or the urgent care?
Oh, that's a good question, Dr. Wagner. So the question was, in case y'all didn't hear it, why would a kid with ear pain want to come here instead of the emergency department or to an urgent care? And frankly, the best way to put this is probably ears are what we do.
That's true.
How many ears have you looked in your entire career, Dr. Wagner?
Oh gosh, probably a million.
Probably literally
yeah.
a million ears. And so the benefit of coming to this office, again, even during walk-in hours or scheduled in, is you get the advantage of having a board certified pediatrician come in and take a look and to say, hey, this is what this is. And she can tell, frankly, faster than a wet setting hen.
That's right. The other reason is we said earlier that we're counting ear infections.
We do count them.
So it's important to know how many and if the medicine we gave cleared, and not to give the same medicine every time.
Yes.
Because that builds up bacteria resistance where the bacteria does not respond to the antibiotic. And also, children are dosed different than adults. So it's important to get the proper dose, the proper medicine. Keep track of how many so we know what our long-term plan is.
Yeah.
And most of the time, children are complain at night because it hurts when they lay down. But if you give Tylenol or Motrin, keep them comfortable. Most of the time you can wait till the morning. And we certainly will usually be able to get you in that same day because we don't want your child to suffer.
That's true.
But it might be worth waiting just a few hours through the night to keep the care consistent. And
we have all the cool tools here.
We do have the cool tools.
We have all the cool tools. I don't know if other places have, the tools, or again, frankly, just the experience that we have. So if I were seeing a child and I looked in the ear and I said, hey, what is this? I have the luxury of being able to pull again one of these doctors in and say, hey, what do you think about this? And they, they're always on the spot with it. So,
okay. That's all the questions I have today, Chris.
Okay.
Bye, guys.
All right, guys. Hey, listen, if you like this video, if you found it interesting or informative or any of that other stuff, please like it and share it. There's a little bell that you can press, and that will notify you whenever we are on. So, my Aunt Tracy said I had ear infections. Yes, I did, AT. I sure did. She would carry me and hum by your ears, and sometimes it works. AT, thank you. So, listen, we love you guys. If y'all have any questions, please call our office. We're here for you. We're here to serve you, and we love our kids. So, that's it. I hope you guys have a great Friday, and I hope you didn't get too close to the fireworks, because if you did, you can't hear. All right, see you guys. Bye.